Good evening to everyone who is present here. On behalf of the Indian Psychiatric Society West Zone Branch Research Committee, I welcome you all to this very interesting presentation that we are going to have by Dr. Amol Dongre sir on qualitative research methods for psychiatry research. So, personally speaking, qualitative research is something which has fascinated me a lot right since my residency days. And more than anyone else, actually, I am looking forward to this talk by Dongre sir for my personal learning, and I'm sure the audience will be benefited by it to a large extent as well. So, without any further delay, I invite Dr. Suyog Jaiswal, sir, the additional professor of psychiatry and head of Department of Psychiatry at AIIMS Nagpur, who's also the chairperson for the IPS West Zone Branch Research Committee, to give the introductory remarks. Over to you, sir.
Hi, thank you, Harkishan. It's actually a pleasure to invite Dr. Amol Dongre sir to talk about qualitative research methods in psychiatry. This is a topic which is, I believe, is quite neglected. It's not something which is researched as robustly as quantitative methods in psychiatry. So I believe this would be our attempt to sensitize the psychiatrist crowd of the West Zone so that there can be more research in qualitative domains of psychiatry in India. Over to you, Harkishan.
Thank you, sir. I hope my slide is visible to the audience.
Yes.
So I'll start by introducing our respected chairperson, Dr. Basant Meghna Murthy ma'am, who's an associate professor of psychiatry at KIMS Karad. Ma'am has done her MBBS from the JMF's ACPM Medical College, and she did her MD in psychiatry from the renowned Seth GS Medical College in Mumbai. She's been awarded the Must Enrich Scholarship for the Teachers of Psychiatry by ITOP, that is Indian Teachers of Psychiatry, Minds United for Health Sciences and Humanity Trust, and Infosys Foundation in the year 2020-21. She's also the co-convener of her institute's curriculum committee. Her areas of interest lie in consultation license, psychiatry, neurosciences, and medical education. We welcome you, ma'am, and we are honored to have you here. I would request ma'am to...
Thank you very much.
Thank you, ma'am.
So, can I share my screen?
Right, ma'am.
Yeah.
I'll just...
Thank you. I'll share my
Do you need
screen.
this slide, ma'am, to introduce our speaker?
No, I have made mine.
Okay, ma'am. All right.
I want to show mine.
Sure.
Yeah. Okay. Is my screen visible?
Yes, ma'am, it is, ma'am.
Can you see?
Yes, ma'am.
Yeah, I think now. Yes. So I'm very happy to have Dr. Amol Dongre here. I am no expert in research, leave alone qualitative research, and I know how intimidating qualitative research is. A lot of times we feel comfort in numbers when you start comparing quantitative versus qualitative research methods. I think this is a very useful talk, and I'm also looking forward to learning a lot from today's talk. Dr. Amol Dongre is the additional professor in community medicine at AIIMS Nagpur, and he is the UG/PG alumnus of MGIMS Sevagram. He is also received the International Fellowship in Medical Education in 2015. He's completed his Master's in Health Professions Education through the FAMER Keel program. He is also achieved Masters in Population Sciences in 2007 and is a recipient of K. Srinivasan Gold Medal. He is a regional faculty member for the PSG FAMER Regional Institute, Coimbatore, and Mahe FAMER Regional Institutes, Manipal. He has conducted over 50 national level workshops on qualitative research and has authored several national and international publications. And I took the liberty of inserting the little image of the book he has authored, Practical Guide Qualitative Methods in Health and Education Research. I'm very happy to have this opportunity to listen to Dr. Dongre with that, I hand over to Dr. Dongre.
Thank you very much, madam. Thank you for your kind introduction.
Dr.
Wow.
Dongre,
Am I audible?
is my
Yes, sir, you're audible.
Okay, yeah. So shall I share my slide? Thank you, madam, for your nice introduction. It was indeed pleasure. So I need to share my slide.
Dr. Suyo,
So yeah, is it there on the screen?
Yes.
Am I audible and is it visible? Okay, fine. So thank you, Dr. Vasant Meghna, Dr. Harikishan, and Dr. Suyok for having this session. And as Dr. Suyok briefed me that this session is mainly kept for the practicing psychiatrists. So I'll try my best to keep less academics and more practice-related points here. But of course, as I will be speaking more for the research, then I have to still talk some philosophical and academic terms to make you aware of the qualitative research tradition. So what I propose in 45 minutes is to give you a quick overview of this content, and then invite some questions from you towards the end of it. Of course, the question answer session is more important than the content that I will be showing here. But let me create some background that this session is actually coming from a 5-day long workshop, and this is the starting session I use for introduction purpose, and I have done some modification in it to meet the purpose for today's session. What I want to cover is about the idea or the concept of a paradigm. Second, to talk about the definition of qualitative research methods. What are the methods and how quantitative and qualitative differ with each other? And what are the sources of qualitative data? And then how do we think of sample size and sampling in qualitative? Of course, there's only one slide for it. And then a little bit about how we analyze the data and how we go for reporting and ethical issues. Okay. So this is the first question I have. And I would like to know from you if you have used this method as a part of your MD thesis or any research work that you have done in the past. Have used this in the past? Write down in chat box yes, and if not, then no need to write. I'll see some responses in the chat box if I hear from you, if there are any points to come. Have you used this method or have you heard of it at least somewhere about? So any response? Okay, I see one response. Yes, yes, as a part of advanced course in medical education. Perfect. So that's great. So that means you have a touch with this method, had a touch with this method in the past. So in advanced course in medical education, people typically use these methods for their program evaluation to know the question, did it work? That is best answered by the quantitative method. And second question that they look for, why and how did it work or did not work? And that is best answered by the qualitative technique. So now let me take you further here. But even if you are not using these methods, you still need to read some journal articles. And when you to improve your practice, and when you think of improving your practice, you need to be aware of these methods, that how they generate data, how we draw the conclusions from their findings. So the purpose is to tell you what happens at the background when you draw the conclusions from qualitative. While I was preparing this session for today's meeting, I did little literature search to see how much is the application of qualitative research methods in Indian Journal of Psychiatry. So I got one paper recently published saying that in the reference period of 2010 to 2019, there were 356 papers published in Indian Journal of Psychiatry. In that, only 12 papers, approximately 3%, qualitative research methods. In that, only 5 were pure qualitative and 7 were mixed method research. In the same article, authors further quote that out of 2,297 abstracts published in the same reference period in Annual Conference of the Indian Psychiatric Society, only 28 had used QRMs. That is 1% consisting of 20 qualitative and 8 mixed method papers. Let's hear why. These methods are not a new thing. They are in practice since long, particularly in European countries. But why we have such a less application of qualitative research methods? This comes from one of the paper published in Indian Journal of Psychiatry. So what do you think could be the reason for such a poor application of these methods? Although there are plenty of situations in your field, perhaps more than others, where you need to apply qualitative research methods for your practice. So can you write down some responses in chat box so that I hear from you that there are very few applications of it. Any response from the audience? Okay. So keep on writing your response, and when I get time in between, I'll just visit. There are issues, I mean, there are less application to it. So I see one response. Yeah, people are afraid of qualitative research methods. Okay, fine. Thank you. Now let's see. There are some concepts you should be clear about. How we see the world decides how we design and conduct our project. So philosophical assumptions forms the base for research that we do. And this philosophical assumption we call as paradigms are basic sets of beliefs which guides our research work. And let me tell you those paradigms in brief, and then you come to know where and how qualitative research is positioned in the field of research methods. First set of researchers, they are called post-positivist researchers. They believe in empirical observations and measurements using numbers. They want to determine figures. For everything that you talk to them, they want to get the proof of cause and effect relationship. And so they collect data on lots of variables, do some statistical analysis, and finally narrow down to a few sets of variables which they call as determinants. They are more into theory verification, and they are typically best practiced in the field of hard science such as physics and chemistry. The cause and effect relationships are a bit straightforward and partly to some extent in epidemiology as well in quantitative research. The post-positivist researchers are mainly quantitative researchers, and they want proof of cause and effect relationship in ascertaining, in deciding the causality for any exposure and the outcome that comes out of it. Now, this is one set of researcher. Now, there are other sets of researchers. They are mainly called as constructivist researcher. They don't believe in single truth. They don't believe in single truth. They say that the truth is multiple in nature. Just as post-positivist researchers believe that there is single truth and it can be measured. These people believe that there are going to be the multiple dimensions to the same truth. and then they can't be measured. But they're more into understanding. They believe in construction of knowledge. They look for multiple meaning. They are into theory generation. And most of your leadership theories, education theories, and management theories are social. One of you mentioned that you heard of these qualitative methods in ACMA course. And if you know the educational theories there, none of the educational theories come from any quantitative research, or also not from qualitative research as well. They are mainly socially constructed or constructed by some education psychologist with a vast experience and observation of education. Well, this paradigm received good attention in curriculums of Western countries, and they started talking about qualitative research methods in addition to quantitative orientation to their students. Now, this paradigm, we call it as constructivism. Later, we got another paradigm called advocacy participation. These people started believing that who gets the benefit of research? It's the researcher who gets the benefit of research. They get paper to publish, they get promotion, they get paper to present in conference. But what about people? They are supposed to get the benefits from that research, but do they get that benefit? And so these people started questioning the practice of institutionalization of knowledge. And they said that the benefits of research should go to the general people for their empowerment. They see research as a social action. They are more empowerment oriented, they are collaborative, more change oriented, and they are into mainly of a participatory and advocacy. And so they want to go for a change. Later on, we got another paradigm called pragmatism. And these people started saying that we don't want to get into the business of single truth versus multiple truth. We just want to de-emphasize the philosophy of truth. And we want people to use methods according to the research question that they have. And so they are more problem centered, they are more real world and practice oriented. And this is called as fifth methodological movement, a fourth methodological movement. And these people say that typically use the mixed method research. They use quantitative and qualitative in one single design. They are mainly into the design-based research, particularly if you are a medical teacher. I would suggest you to go to AME guide number 6A and read design-based research. They actually claim to bridge theory-practice gap by addressing the problems of real world and helping the people to get the best of the research. How many paradigms we learned? We learned four. Was positivism, constructivism, participatory advocacy, fourth is pragmatism. Now, I'll give you a short exercise just to check your understanding immediately after the slide is done. Now look at this slide carefully, and you will see that if you want to study effectiveness, then typically people go for quantitative method. If you want to look for process, people choose qualitative method. For safety, you have all the choice depending on the question that you have in hand. For acceptability, qualitative is the best choice. For cost effectiveness, you have quantitative. Satisfaction and consensus, typically we choose. Of course, it depends the way you frame the question. The methods, the choice of methods would go accordingly. What is your observation? If you look at this table carefully, then you have plenty of indications where you need to use qualitative. If you remember, I showed you one slide where we have less than 3% papers using this methods as a part of the research process. And nearly only 1% papers, abstracts, claim they use these methods during the conference presentation. So So it means that we have plenty of situations where we need application of qualitative methods. It's those methods because we have fear, we have lack of knowledge about how to apply it, and so we will never thought about it, so we don't go for it. But it doesn't mean that they don't have indication. Rather, by this table, I would like to argue that there are plenty of indications for using qualitative methods in all fields, not just psychiatry or community. I'll take a pause here and just ask you to answer this to this scenario. If you are a researcher and I ask you, test the effect of new drug on patient's outcome, what paradigm do you think is more appropriate for research? You have four choices: post-positivism, constructivism, participatory advocacy, and the fourth one is pragmatism. You have to write down your response in chat box. This just to break the monotony in between so that I come to know that you are with me when we are doing the exercise. So you are a researcher and you believe that you can test the effect of newly introduced drug on health outcome of the patient. So which paradigm do you think is most appropriate for carrying out the business? Yeah. So write down your response in chat box. You tell me the correct answers of it, and that checks your understanding of the concept of philosophical assumptions in carrying out research. Feel free to write down your chat response in chat box. Write it. Okay, I think one response is any other views on this? So now just think, effect of drug on patients' health outcomes. So typically people do a clinical trial in this situation. That means they have a hypothesis and they assume that drug has an effect or drug don't have an effect. There's only one answer, yes or no, that's right. And so they can measure that effect in terms of some outcomes, some laboratory, the measurements, some parameters. So the correct answer uh, is to see this as a post-positivism, right? The second topic here is exploration of experts' opinion on rehab services in India. Now here, you don't want to test anything, but rather you want to explore the thing. And the best approach here would be, what do you think? Can you write down your response in chat box? The best approach here would be constructivity. And third here is the empowerment of community members in addressing common mental health problems. It's empowerment oriented. So the philosophical assumption that one would choose here to carry out research would be mainly participatory and advocacy. Yeah. Response here. Yes, that's correct. That's participatory and advocacy. Perfect. So thank you, Dr. Vasant Meghna, for your response. Now, as we see this, so when you pick up any research paper to read, ask yourself a question: which paradigm authors might have used to answer the research question? Just as you have different designs in quantitative research, like cross-sectional study, case control study, cohort studies. In qualitative research, you have different approaches. We call them as design, but here we call them as approaches, like descriptive design, ethnography, phenomenology, phenomenography, crowd theory. I will be explaining the details of all of this. And these are the key designs or theoretical underpinnings that you need to consider when you have a research question. For psychiatrists, for clinical people, I always insist that they often need to use this technique or critical incident technique. It's suitable for your setting. So you have to fix up one aim and you come across some incidents in your clinical practice. Sometimes you get success, sometimes you get failure, sometimes you get turning points. Those are the critical incidents. Select those incidents. Once those incidents happen, you select an observer, collect some data through interviews by doing observations, and then you analyze that data to find out the categories that comes out from it. And finally, you get an interpretation from it. So in clinical practice, you have several situations where you need to apply these methods as this approach as for your data collection method. Some commonly studied topics in psychiatry or in, I would say, overall health sector people focus on living with cancer, HIV, psychosis, and epilepsy. Particularly, these are the topics I'm suggesting, and I see people use qualitative methods for them. So conditions with stigma and discrimination that you have in your field as well, you have certain conditions. For example, patients living with psychosis and epilepsy face stigma and discrimination. Issues related with sexuality, problems of caregivers of chronically ill patient, traditional healthcare practices, and the cultural practices for treatment of some conditions, or you see for related reference to nutrition, childcare, and mental health problems, curriculum evaluation, building consensus for action, and finding out operational problems. For example, in your clinical practice, if you are seeing that certain behaviors are very common in patients, and even after you educate them, they continue to have those behaviors like non-adherence to treatment, loss to follow up. You would like to know why that's happening. And those situations where you want to know the question, you want to get the response to question why and how, then the best approach for you is qualitative research that here. The definition of qualitative research is about getting the text data to get the insight of underlying reasons, opinions, and motivation from subject's point of view. You want to know what they are going through when they are receiving treatment on psychosis, or what their caregivers are going through when they are receiving treatment for that. What are the challenges the caregivers of a schizophrenic patient, caregivers of schizophrenic patients face? And what are the challenges the patients with epilepsy face in their personal, social, and academic life? Those are the issues that you would like to explore to develop ideas, to get the hypothesis for your quantitative questions. So, in qualitative research, we want to know what participants are thinking. That's not the only thing we look for. We also want to know why you think in the way you think so. So that's how you come to know that this is how the psychology is working, the way people think is working, what some decisions that they make in their life. So now think of your situation in the field of psychiatry. I gave you some examples from my experience. Now you have to think what are the situations where you think application of qualitative methods is appropriate. So I give you 1 or 2 minute time to write down your response in chat box. And I would like to hear from you that what are those situations which really bothers you in your clinical practice, and you want to know the answer to that. And typically those questions are why type of questions. So try to write down one or at least one why type of question from your clinical practice. Meanwhile, I say some people, we are supposed to go to our yes, I see one response. I see, yes, that's exploring the reasons for frequent changing in treating doctors. So perfect. That's a good question. Why patients hop from one clinical setting to another? And so we don't know. There may be multiple reasons for it. We want to explore that. So that's a good topic for doing a qualitative inquiry. Reasons for discontinuing the treatment. Yes, thanks, Dr. Aditi. Dr. Nitisha writes, why do patients not start treatment despite visiting the psychiatrist? Yes, perfect. So now you are really getting wonderful topics that can be used for your research question. Thank you very much for your responses. Good points. So the goal of qualitative research is to explore, that you have very rightly mentioned in one of your responses, is to describe and then is to document the process. What pathways patients take when they hop from one facility to another. I see one more response is here. Why do students not attend psychiatry lectures in UG? Well, we have the same question in community medicine as well. Why students don't like community medicine classes and why they don't come there. So you may explore for your settings as well. Right. So then we may have some issues of defining the boundaries of domain, or you may wish to develop a model or theory, a framework. I see the last question that I read, why students don't attend UG, undergraduates don't attend the psychiatry class. There may not be just one reason and multiple. And so explaining that complex phenomena is hard enough to by listing few reasons. So for that, people usually make a model or theory or a framework to explain those kinds of complex questions. They are more of generating models, theory, and frameworks for carrying out the research on that. So the difference in quantitative and qualitative research is that is quantitative research assume that there is single truth in the universe and that can be measured. More into estimation, they go for statistical generalization and they do probability sampling and they go for using questionnaire as a data collection. And they typically look for a representative sample collected in a random fashion. And they may have or may not have the sampling frame. However, in qualitative research, the assumption is that there is no single truth in the universe. Yes, Dr. Vasanta Meghna, madam. Please unmute and
Yes,
ask your question.
can you just speak a little loudly? I'm not sure if it's my internet, but I feel you're talking a little softly.
Now, am I audible clearly?
Yes, now it's better.
Okay, fine.
Yeah,
Okay.
thank you.
So, thank you. Thanks for your feedback. Yeah. So, in qualitative research, we assume that there is no single truth, but there are multiple ways people look at the same thing. And they don't go for estimation. What they go for is exploration, understanding of the phenomena from the participant's point of view. I see one response. Please explain mixed method research. Yes, that's beyond the scope of it, but in mixed method research, we use at least one qualitative method and at least one quantitative method to answer research question in single design. We call that as a mixed method research. Right? So we have this thing. Qualitative researchers go for non-probability sampling. And yes, I see example for mixed methods. Right. For example, I want to know how many students don't like UG psychiatric classes. And I also want to know why they don't like it. But I want to answer this question in one single study. So the first objective of my study would be Out of 150 students in the class, how many of them don't like UG psychiatry classes? That can be easily measured through a survey. So you used a quantitative method for it. But for the second question, why they don't like it, and you have no idea and you never studied that before. So then in that case, you will conduct some interviews with students, have some focus groups with them, and then do the thematic analysis of it. And finally, you will say that the first part of question says that out of these many students, these many numbers don't like to attend UG psychiatric classes. And the prevalence is 20%, 30%. And, or the proportion, I would say here. And then there are 6 variety of themes I got from it. And these are the 6 major reasons why people don't like these classes. And you answered these 2 questions in one single study, and we call that as a mixed method study, right? So we use a non-probability sampling here. And so typically they use a small sample size, and what they use for data collection is to guide. They are sets of few small open-ended questions, and they ask responses based on that. What will be the research question for that example? The research question for the example which I just stated, that how many percentage of students don't like undergraduate psychiatric classes? First question is over. The second question here would be, what could be the reasons for them for not liking the classes among those who don't come for the classes? So you have 2 questions. There is no one single research question in mixed method research, right? Thank you for your questions, and they really keep the sessions more interactive. So, and in qualitative research, you may or may not have sample frame. So if you use both of these together in one single design, that becomes a mixed method for you. What we do in sample size, we don't have any statistical formula for sample size calculation. What we do here is we follow some decision rules, and like that we assume that we will achieve the saturation of information by conducting 10 to 12 interviews. So we stick to that. There are some assumptions to keep in mind, and you need to consult a researcher if you are conceiving or developing a project on mixed method or qualitative research to decide the sample size for the project. Qualitative researchers, as I told you, use non-probability sampling. And there are 15 types of non-probability sampling. And you have to choose the one which is best suitable for your research question that you have in hand. And that is enough for you to talk about for sample size and sampling. Right. So the decision about sample size and sampling in qualitative research depends on the research question that you have, the resources that you have in hand, and the previous literature on the topic that you want to study. Minimum sample size for qualitative research, right? So if you are doing one-to-one interview, we say that if it's a phenomenologic research, we say that 6 to 7 interviews are enough for you. And if you are depending on the saturation of information, by saturation of information, I mean that you tend to get the similar set of information after a certain number of interviews. And there are certain rules, and you have to use some references when you make a choice. So typically, 6 to 7 interviews tend to give you a stable findings. And after you achieve the saturation, you conduct 3 more interviews. However, the answer is not so simple and straightforward as I'm giving you. You need to take lots of context factors in mind when you decide the number of interviews to be done, right? So after this session is over, I'll be sharing some articles to Dr. Sui and request Dr. Suyog to pass it on to the groups, which talks about methods, sample size, and data analysis. You may read that, and if you still have any questions, you're most welcome to ask me those during the session and even after the session is over. So there are many sources of qualitative data, as in case here, that they come from the focus group or one-to-one interviews. They may come from photographs, films, and do the analysis of those films, observations, field notes, diaries, reports, minutes of the meetings, networking sites, because nowadays social media is shaping people's opinion. They are powerful platforms, not only for socialization, but for research as well. There are discussion forums, press clippings, social media posts, reflective writing. These are all sources, and there could be more than this. You have plenty of options for collecting data for the project that you have. The most commonly used are one-to-one interviews and group techniques such as focus groups. What's the question here? Why is a sudden rise in interest in qualitative research or in mixed methods? So I would just like to give you 1 minute time. You can quickly respond to this question that people are now getting more attracted towards qualitative and mixed method research. Why this movement is happening? Though I showed you that in some specialty journals we have less articles on this, but there's a growing interest on it. So what do you think would be the reason for that? Any thought, any response? So a lot of research is being conducted and topics are becoming repeated. Yes, same topic getting explored many times. So we want to go beyond that. Second is all questions cannot be answered by quantitative methods, and when some are answered, the reasons are important to make a change. Okay, that's important. That just knowing is not enough. But then we also need information to make changes. I mean, the change management is a challenge after finishing the scientific inquiry. Perfect. Thank you very much for doing this. So now there is a shift in focus from how long to how. I mean, how long you live is important, but with what quality of life I will survive? That's a question nowadays patients are asking. So they just don't want to live longer, but they want to live with a good quality of life. Now there is an increasing use of mixed methods for comprehensive understanding and to get a complete picture in one single design. So they want the policymakers and decision makers don't want you to refer to another study to answer some of the questions, but they want answer to those questions in one single design. Also, there is an expectation from funding agencies. Some scholarship insists on mixed method research. There's also an issue of accountability. And there is also the culture of robust impact evaluations coming up. So in that context, the use of mixed method research, the application of qualitative research methods are getting common. So what are the different types of it? So there are some participatory research techniques. You have 32 different tools and techniques. So read more about it. And you can apply those in your psychiatry research. They are not just for community medicine. They are not just for public health practice in community setting, but they are equally applicable in clinical settings as well. There are in-depth techniques, it's repeat here, like focus groups, you have group interviews, you have nominal group technique and Delphi. They can be used. Systematic techniques like pre-list and pile sort can use people. So your menu card is broad, and you have another, like the issue coming up nowadays is about using qualitative research in online spaces. So your menu card is quite broad. You have different options. Right? Now this is one focus group happening, and one of my colleague, he he was doing a research on epilepsy in psychosis. So they developed some weakness in consultation with a psychiatrist colleague of ours. And they read out those vignettes to these women and evoked a discussion around it. Like they were asked a question, what do you call this condition as? And they gave their local terms for it. And then they asked next question on what could be done for this? What do you think it is due to? And what is going to be the consequence in the future if the person is not treated, and how the person should be. And this is a good and very powerful technique to get insight into what people think about it, and next about why they think in the way they think about that condition. And that understanding is very crucial for you to develop a counseling guide for your patient, because you just can't and don't do that, but you also have to give a logical reason which they will understand. And that is possible only when you first know from them what they think about it and why they think in the way they think so. And the qualitative research helps you here in understanding what's going on. You might need to sit with them on one-to-one basis, do some exercise, some card sorting exercise to know their perspective. So there are some techniques which, if you attend our workshop, will come to know, will help you to know that in what way you can apply this in your educational and in your psychiatry research. Do you have any question on the methods? Then I have just few slides on a quick overview on analysis. So if you have any question, you can raise your hand and ask question, or just type your question in the chat box and I will take that question when I finish the slides. Any question? Anybody want to raise hand and ask question here? Okay. If not, then I will proceed further. But feel free to write down your question in the chat box. So as you collect the text data by interviewing people, then you transcribe that data. You convert spoken language into written, type it down, and then you read those typed content and you decide the unit of analysis for it. Well, here's a question. Why do journals not have many articles on qualitative research? I mean, we can do a research on that topic. So many journals feel that the qualitative research is second-class research, and the findings of those qualitative research can't be used in policy decisions. And that is now not the reality. Qualitative research is a science, and the qualitative findings are being used in evidence. The research in the field of qualitative research has gone to the level where people have started doing qualitative meta-analysis, systematic reviews of the qualitative studies. So the journals need orientation to these methods. The other reason, they don't get reviewers sometimes. So the review process gets stuck. And so that's one reason. You may find out the reasons more than this as explore yourself. So we decide the unit of analysis. Then you code the relevant text data. And you shift from units to categories and forms. Then you draw the conclusions from it, and then you finally report it. I will try to show you this in a diagrammatic form here. You have codes. Codes mean similar lines or words. You bring them together. When you bring them together, you form the categories. Categories are large enough, you may have a subcategory. When you bring similar categories together, you form the concepts, and in the concept, you form the theory. And finally, you shift your journey from real to abstract, from more particular to more general. We do the same journey in quantitative research as well. We collect data, we analyze it, and finally, we want to build the causal model in the form of, I would say, kind of a theory to explain how that thing happens and how the determinants are linked with each other. Right. You have some softwares, just as in quantitative research, you have EPI, you have SPSS, you have Stata. In qualitative research, you have Atlas TI, you have NVivo, you have Anthropac, UCINet, and many more than this. I use them often for my work. So people use these softwares for their data analysis. So they take help of it, need a little bit of training on how to use this thing. Is content analysis different from thematic analysis in qualitative research? Yes. In thematic analysis, you deal with the text data and you analyze that text data to get the categories. And it's mainly a kind of more of a descriptive process that you do. In content analysis, you do some number crunching, you do some counting as well. And then you say how many times those words came or how many times that particular theme came. So in typical research, people do both thematic as well as content analysis on a single project. Earlier, these terms were used interchangeably, but now we use example. For example, if you if you do some set of one-to-one interviews, you can do thematic analysis. If you do free listing and file sorting, what we do with that is a content analysis. You have lots of data coming and you do some processing of it and express it in the way which will help us to make meaning from it. And we have different ways of presentation, qualitative research as well, perhaps nearly 15 different types that we report. How to report content analysis? Typically, they are expressed. I'll share one paper with you. They are sometimes expressed in terms of frequency count or in the form of Smith's value. That just tells how prominent that particular phrase words were there in the particular transcripts or particular listing exercise that you did with the participant. So expressed it in terms of numbers, but that number just says the salience or the prominence of those items in the text data that you generated for your research. Right. So here is one diagram which comes from one of my book chapters, where I try to explain that how the research process takes place. You have transcription, you have manual coding, you have codes and categories finally, and you have presentation of data. But you see at the background what's happening here. You have some quality measures in place. It brings a kind of trustworthiness and rigor to your findings. So when you prepare transcript, you may share transcript with the participant to check their understanding and your understanding. When you do manual coding, you practice having one more colleague with you so that you do that exercise jointly or you do it independently and then relate each other's work, or one does it and the second one reviews it, right? And you acknowledge your personal biases when you are doing this kind of coding. You can do the researcher triangulation, as I just mentioned. And you can share the summary findings to the respondent and ask them that, look, this is what I have done. Just check whether that's making sense to you or not. And so this way, you have a big responsibility as a qualitative researcher to accurately represent the thoughts of your participants. So right from when you collect data to analyze it, you remain aware of that responsibility and take some measures to check your understanding so that you represent their thoughts in the write-up that you have got. Right? So people have some barriers in use of qualitative research. There are barriers like people say, we are not trained. Second, people say that we have a perception that quantitative research is more superior. And third, policymakers don't like qualitative findings. But these are the barriers why people. Some people think there are lots of ethical issues when you conduct qualitative. Yeah. So these are the barriers which I just mentioned. So people ask question about validity and generalizability finding. What you call internal validity in quantitative research is called credibility in qualitative research. And what you call external validity in quantitative research is called as transference. It has a little bit different terms and the measures to check them out here. And these are some of the rigor criteria that you need to uh, ensure, right, for your quality. And I have just mentioned about member checking and debriefing, the image that I had showed. Also, I mentioned about triangulation. Well, all this requires a careful training and a careful attention. And the last one, I would just say that when you're conceiving your protocol, you should have a research question, should talk about paradigm, talk about the approach, whether it's phenomenology or phenomenography, grounded theory or descriptive research. Then talk about data collection, such as one-to-one interviews or focus group. And then mention about sample size and sampling, just as you do in quantitative research. Start thinking about ethical issues right from the beginning when you conceive the business. Think of data analysis plan in advance and also decide how you report your findings. As some of the books I would recommend for you to keep in your collection. The third one is ours, which is from our experience. Second edition of this book will come in print after a month from now, and you may keep that in your collection. So thank you very much for your patient listening. The purpose of this session was to give a quick bird's eye view of qualitative research methods. And I would encourage you to go for further training if you wish to use these methods in your upcoming research work. And if you have any questions or queries, you can write email to me at my email ID, which is given here, or send a WhatsApp message to me at the mobile number. Yeah. So thank you, Vasanta Meghna Madam, for inviting me for this session. Thank you, Dr. Harikrishnan and Dr. Suyok for making this event happen. So I see there are two questions in parking. The names of the book and this. I will share some articles and some book chapters with Dr. Suyog, and I request Dr. Suyog to share it with others as well. So thank you very much for your patience. Thank you. Over to you.
Thank you, Dr. Dongre. It was a really nice session. Although, of course, I think we need a lot more time to fully understand the scope of qualitative research. I think learning by doing ही होना है. So we have support from you, and you also shared your contact information. I think that makes a big difference to us. So I have made a note of it. Anyway, thank you very much. Over to you, Dr. Suyog.
Harkishan, thank you very much, sir. Thanks a lot for the enlightening session. Thanks, Meghna, for making it happen and coordinating it so well. Over to Dr. Harkishan.
Right, sir. So, if there are no further questions from the audience, then I think, sir, do I call it off here, sir?
Yeah.
Yes,
Right.
yeah.
Okay. So I thank everyone who's present here. It's been an hour-long lecture, but I'm sure we all learned a lot about qualitative research. Like sir rightly mentioned, we got a bird's eye view of the whole approach of qualitative research, and I'm sure a lot of us will be able to apply it in the days to come. On behalf of IPS West Zone Research Subcommittee, I thank Dr. Neena ma'am for her endless support. I also thank our respected speaker, Dr. Amol Dongre sir, for the enlightening lecture. I also take this opportunity to thank Dr. Vasant Pingna Murthy ma'am for sparing time from her busy schedule and guiding us so well. I saw ma'am was the most active participant, which was so nice to see. And finally, thanks to Suyog sir for making me a part of this lecture. And thank you one and all, the audience, for being here right till the end.
Just one thing before everyone leaves. Video
Yes.
recording will be made available to everyone, right?
Yes,
So
yes.
we can
It will
share
be
it
there
with
on official YouTube channel of IPS
Okay.
West Zone. Yeah.
All right.
Okay.
Thank you.
Thank you, everyone.
Thank you.
Thank
Good
you
night.
very much. Good night.